where an insulin pump.
Rebecca Redmond spends up to $1,000 on medication every month to stay alive. The cost means the type 1 diabetic often has to ration her insulin. Soon, she might not need to.
I think it's going to help me, and it's going to help a lot of other people across the country, and that's what really matters to me.
This is about health equity.
Canada's health minister has now introduced the legislation laying the groundwork for universal drug coverage. To start, the federal government will cover diabetes medication and devices and birth control.
This is a proof of concept opportunity to try on 2 drugs on a universal single-payer model.
But the legislation does not commit Ottawa to cover all drugs.
And it seems that this was a compromise. There's not a rational reason to restrict publicly funded medicines to diabetes and contraceptives. It does not make sense from a health perspective.
Ottawa pledges to create a list of essential drugs it may eventually cover and an agency to bulk purchase medications within 1 year of the legislation passing, which it likely will with support from the NDP. They've pushed the Liberal government to bring in Pharmacare.
It also sets a structure for builds a foundation for further expansion down in the future for governments that want to go there, and of course the New Democrats. If we're government, we would want to go there.
The cost to cover those 2 types of drugs?
Maybe $1.5 billion. I think it's, the question is it going to be lower than that? Is it going to be a little bit higher?
The health minister says Canadians could start getting their diabetes medication and birth control paid for as early as next year. But to get there, he'll first have to negotiate funding deals with the provinces and territories. So far, Alberta and Quebec have both said they're not interested in the plan. Marina von Stackelberg, CBC News, Ottawa.